Colorectal cancer is a major health threat in Malaysia.
70% of the patient coming in with later stage like stage 3 and stage 4.
But there are times when the symptoms are very subtle.
So we would like to emphasize the importance of screening.
Get yourself checked even though you don't have any symptoms at the age of 50, and you need to include biomarker testing.
And the role of biomarker are mainly
Colorectal cancer is a major health threat in Malaysia. It is the number 1 common cancer among men and the second most common among women. Here's the problem. 70% of people diagnosed at stage 3 and stage 4, making treatment and recovery far more difficult. Joining me here today is Dr. Tan and Dr. Luqman. We are here to discover and talk about biomarker testing. Can you introduce yourselves?
Hi, I'm Dr. Luqman Mazlan. I'm a colorectal and general surgeon.
Hi everyone, I'm Dr. Kiang. I'm a clinical oncologist.
Dr. Luqman, you've been seeing patients since the earliest stage. Can you tell us about what are the symptoms and red flags that people should look out for in colorectal cancer?
I think most patients will be worried when they come with very alarming symptoms like rectal bleeding or abdominal pain. But there are times when the symptoms are very subtle. Like, for example, changes in bowel habits. Every individual has a different bowel habits. Some people go once a day, some people go once every 2 days, some people go twice a day. Well, what's important is you need to know what is normal for you. And something that is not normal of more than 2 weeks, I believe you should go and see a doctor.
At what age do you think is the recommended age to go for screening?
The current guidelines in Malaysia is that if you don't have a family history or any risk factors, then you should get checked when you reach 50 years old. But however, if you have any symptoms or if you have a family history, then you may need to be seen earlier.
Just to add on a bit on that will be like, if you say you have family members, close family members, diagnosed, say, with colorectal cancer at age 35, for example. Hence, this individual shouldn't wait until they are 50 to go for the screening. So normally we will recommend them to actually start 10 years earlier from the age your close family members was diagnosed with the colorectal cancer. So like in this case, the family members were diagnosed at 35, so this individual should start considering the screening at 25. Earlier, you did mention about 70% of the patient coming in with later stage, stage 3 and stage 4. Hence, actually, we do not want them to come in when they have the symptoms. Right? So we would like to emphasize the importance of screening. Screening means that when you are talking about healthy individuals, those who do not have the symptoms, so when they come in and do the screening test, and when they are being picked up to have a colorectal cancer, chances are it will be at an earlier stage. The issue in Malaysia is that many patients only come forward to the hospital for checkup when they have symptoms, and hence it's being reflected in the number or percentage of patients who are diagnosed with stage 3 and stage 4, right, which is 70% like what you shared earlier. So I think that is not what we wanted, when they actually have the symptom to come in. What we want is actually before they even have the symptoms, so that when they come in, and chances are, if they say they are diagnosed with colorectal cancer, then it will be at earlier stage of stage 1, stage 2. And the importance of this is that the earlier the stage of diagnosis, their outcome, right, and the treatment they need to do will be easier, and their survival will be better as well compared to those who are coming in with stage 3, stage 4.
To follow up on that, can we understand how does one go about getting their biomarker testing and what is the whole process like?
Okay, firstly, I think when you talk about biomarker testing, right, generally it is a very broad term that we use when we talk about testing on the tumor itself. So what happened here is that when you're talking about the journey of a cancer patient, right, mainly when the patient presented, either they are diagnosed with the cancer when they are doing screening, that means no symptoms, or when they come in with symptoms, and then they did further investigation, and hence they're diagnosed with the colorectal cancer. So once a colorectal cancer diagnosis has been made, we need to actually stage them, right, with a scan, either a MRI, CT scan, or PET CT scan, to know whether this is an early stage like stage 1, stage 2, stage 3, or whether this is an advanced stage. And the role of biomarker at the moment in colorectals are mainly in patients who are diagnosed with advanced stage, where it actually helps the doctors to guide on what will be the treatment of choice, which drug to be used, which one is going to be more effective to treat the patients.
Dr. Tan, how does Hospital Picasso ensure that patients have access to biomarker testing as part of their care?
In Picasso, we adopt this integrated approach where all the discipline work hand in hand together while we manage the patients. So we don't go like solo, or one-man show kind of thing. Because when you're talking about management of cancer, colorectal in particular was never going to be a one-man show or just one discipline, like just the surgeons or just the oncology, right? So we adopt the integrated approach here in the sense that we have regular tumor board meetings. So we discuss about cases, what will be the best approach, for the patients to give them the best outcome possible. Because individually, everyone comes in, very different. So you have different patients' factors like their age, their underlying medical problems, their presenting complaints. Then you have disease factors like where is the tumor lies, whether they are actually fit for surgery or not, whether is it the tumor too big to be operated up front, or you think that surgery is better off to do it in front rather than the other way around. So all this will require discussion. So by having the integrated approach in Picasso, we assured that when the patient comes in, we would have discussed among ourselves on what would be the best. So when you're talking about, say, biomarkers, so that is being part of the role from the pathology colleagues as well. So hence, when we actually has frequent discussion with our colleagues, and sometimes things can be fasten the process to do it. For example, from the time a patient had a biopsy till we need to send for the biomarkers, sometimes the result will be back within 2 weeks or so.
Is there anything else you would like to say to people who are maybe a little bit worried about doing biomarker testing or anything related to the colon area?
The take-home message here is that you have to know that colorectal cancer has a very high incidence in this country, and that you must get yourself checked even though you don't have any symptoms at the age of 50, right? If you have symptoms or you have a family history, you may have to do it earlier. And unfortunately, if you get diagnosed, then you have to go through the process, which may include surgery, chemotherapy, radiotherapy, depending on the kind of tumor that you may have. And you need to include biomarker testing, if it's recommended by the doctors, to help guide the best treatment options available.
To me, I think the take-home message here will be two. Number one is that screening, right? I'd like to emphasize again the importance of screening, because we want to diagnose the cancer at earlier stage, because that will change the patient's outcome and prognosis, right? Irrespective of what the doctors do. So that is very important. So do not wait till you have the symptoms, right? So if you have the risk or you're unsure, please talk to the doctors to do the early screening. Second thing is that in the event, if let's say the patient is unfortunately diagnosed at advanced stage, right? Even though we might not be able to cure the patient, but it's still very much treatable, especially with the help of biomarkers, which will help us to guide the most effective treatment for the patients, so that the patient can have a better outcome, right? And even with technology nowadays, right, sometimes we might not even need to take the tissue from the patient to send for this biomarker testing, because we can do what we call a liquid biopsy, meaning that we just need to draw some blood from the patient and then we can proceed with the biomarker testing as well.
I think it'll be very rest assuring for our audience that they hear that they are under so much care. And for that, thank you very much, Dr. Tan and Dr. Luqman, for sharing such a valuable insight. If you or your loved ones are experiencing any of these symptoms, remember to talk to your doctor and ask about biomarker testing, because early detection truly saves lives.